Hello, my name is Sahar, and I'm a student at Franklin University, and I'm presenting my topic of choice, which is nurse practitioner role with the focus on endocrine nurse practitioner. First, we talk a little bit about nursing background, which is there's increased demand for healthcare and rights and chronic conditions, increased demand for advanced practice nurses. Nursing evolved over time with different specialties in regards to different healthcare needs and again, demand for increased healthcare. Also, the role of nurses have been more defined and specialties evolved. And so we go into the next slide, which is nurse practitioner role. And my specific nurse practitioner role that I chose was endocrine nurse practitioner. Endocrine nurse practitioners mostly work in offices, private offices. Sometimes you see them in the hospitals, but mostly they work in a private office with a doctor. So nurse practitioners in endocrine, they specialize in endocrine system, and they have a understanding of the whole endocrine system, and they mostly treat patients and diagnose patients with endocrine diseases. And endocrine nurse practitioners also perform thyroid disorder screenings and educating patients and family regarding different thyroid disorders. So, in clinical setting, most of the thyroid disorders that are frequently seen are diabetes mellitus and thyroid disorders such as hypothyroidism and hyperthyroidism. Next slide is also about how endocrine nurse practitioners collaborate in their office and their work daily. So most endocrine nurse practitioners initiate treatments while managing the patients. Endocrine nurse practitioners will collaborate with endocrinology for overall management and follow-up to ensure better management of thyroid disease, accurate diagnosis, and quality of care. And also, endocrine nurse practitioners collaborate with patients and families, like we said, to come up with a better plan of care and treatment plan. So, also with other interdisciplinary team for a better quality of care for the patient. And the next slide is talking about importance of guiding and coaching patients as a endocrine nurse practitioner. So endocrine nurse practitioners spend time in coordination of care for patients. Endocrine nurse practitioners spend time interacting with patients mostly. They spend, research shows nurse practitioners spend more time with the patients than the doctors. Endocrine nurse practitioners also provide education for patients regarding the thyroid disorders, educating them about the disease and giving them more information about their condition. Endocrine nurse practitioners communicate with patients and provides treatment plans, making sure the patient understands the treatment plan and follows the treatment plan for a better outcome. And the more nurse practitioners spend time with the patient, educating them about the disease process, the more the patient understands and follows up with a treatment plan. So that's a good successful part the nurse practitioners do to spend more time with their patients. The other part is nurse practitioner role, leadership opportunities, and endocrine NP roles. So, as a whole, nurse practitioners show a lot of leadership with their nursing background. They collaborate with other clinicians, and also nurse practitioners with their nursing background. They can bring key impacts in decision making, such as different patient care and many other important information the nursing background. So, also nurse practitioners can serve in leadership opportunities as mentoring and training. For example, students or other new nurse practitioners. And also sometimes nurse practitioners can help mentor doctors about a special opportunity about educating a patient, so they can be very important in the leadership role in an office. And also nurse practitioners can bring a better quality improvement as they are more advocating for the patients, so they can bring that in their leadership role as well. And that's mostly it about the nurse practitioner as an endocrine nurse practitioner, and these are my references. Thank you for listening, and I hope this presentation was helpful. Thank you. Bye.